Witkowski, and I am the teen librarian at the Maplewood Memorial Library in Maplewood, New Jersey. Our library's mission is to connect people to information, ideas, culture, and each other. We do programs, we have conversations on tough topics, we partner with our community, and it's all in an effort to connect each other. There are really no other community organizations that are open to all the way the public library is. We help people find housing, we help people apply for health care, for jobs, and for teens in particular, we provide a safe space for them to learn and grow and become productive community members. I think being a Bloomberg Fellow has enhanced my work at the library tremendously. For example, when the high school community experienced a tragic loss, I was able to provide social and emotional learning resources to the administrators and counselors at the school, and I found those resources through my coursework and research at Hopkins.
Please welcome Health Commissioner of the Philadelphia Department of Public Health and a true friend of the initiative, Dr. Cheryl Bettigole.
Good morning, everyone. Ooh, I'm sorry. It is such a pleasure to be here with you all and really a privilege. And I want to start this morning with a few thank yous. One of which is a long-delayed one, to the Johns Hopkins Bloomberg School of Public Health, I can't talk this morning, where I did my MPH years ago and where I learned things that I still use every day here in Philadelphia. Also, to the Bloomberg Fellowship and to Mike Bloomberg for just a tremendous opportunity that we have taken really full advantage of, and just tremendous thanks. We are, I believe this year we have our 7th fellow starting, and it's just an unparalleled opportunity for learning, for professional development, and for investing in the future of public health leadership in Philadelphia. So thank you. And I also, as I'm thinking about the work we do here in Philly, wanted to thank our thought partners, the Partnership for Healthy Cities, Big Cities Health Coalition, the people we learn with and grow with and try to solve these really difficult public health problems with. And then, of course, all of our community partners without whom we really could not do this work. So I get to talk with you this morning about adolescent health. And it's an amazing age and an amazing moment of possibility. It's a moment for us in public health where we know that if we could change the systemic factors that cause disparities, we could change the whole course of a child's life. It's also a moment when we, as a society, as healthcare providers, sometimes even as public health professionals, sometimes switch from treating children, especially young children, as the vulnerable beings they are, who need support, who need nurturing, and for whom we really recognize the importance of systemic and environmental impacts of racism and injustice, to a framework in which too often we tend to see teens as individual actors and too often as individual bad actors who are responsible for their own problems through bad decisions. And I know most of us in this room try our best not to do that, but I also know that we tend to frame things in terms of behavior change sometimes, and we can find ourselves slipping into that individual actor framework. And so as I'm talking through this, I want all of us to be thinking about where are the opportunities to dig deeper and to look for those systemic causes. Because as we all know, willpower does not differ by neighborhood, and the urge to pick up a gun to defend yourself has to do with everything around that teen and not the teen themselves. So how are teens doing in Philadelphia? Well, the next part of this will be a little grim, but our toughest problems, as you know, are gun violence and drug overdose. And you've heard some about those. You will hear more today. But for teens in Philadelphia, we have had 174 teens shot in 2021. Final data isn't in yet on 2022. We had 34 deaths. So, and you heard from Josh Shapiro very eloquently about the impact on all of the other teens who are watching as this happens in their neighborhoods and to their friends and to their relatives and who have lost family members and big brothers and fathers. And so it is devastating. Drug overdose, similarly, we are more than 1,200 a year. So many families touched in our city. There are also major risks to the ability of our teens to thrive. And those include poverty, and we are the poorest big city in America, chronic unemployment, which is very closely tied to violence, the exposure to violence. We've talked about lead poisoning, and we will be putting out data sometime in the next few weeks showing a very close link between elevated lead levels and both violence, victimhood, and perpetration, which is true at every level of income. Our underfunded schools, a crisis in affordable housing, and poor housing quality, which when coupled with high tobacco use rates, leads to really, really high rates of asthma. More than 20% of our kids have asthma in Philadelphia. It's the #1 cause of missed days of school. And if you think about the impact of a child who is already struggling with multiple strikes against them, missing 15, 20 days of school in a year has a huge adverse impact. And then, as you're going to hear more in the next panel, a teen mental health crisis, which is worsened by the fact that we don't have enough resources to help kids. But I do want to focus a little bit today on what's going right. And there is actually a lot going right in Philadelphia, including for teens. Starting with PHL Pre-K, which is free, high-quality pre-K for 3- and 4-year-olds. It is entirely funded by the Philadelphia beverage tax, otherwise known as the soda tax. It started in 2017, and all you need to qualify is to live in Philadelphia. So it's a game changer. Yes, this is amazing. The Octavius Catto Scholarship to Community College, which is a last dollar scholarship, including counseling, including food and transportation, to make sure that kids who can get themselves to community college can stay there. Programs like Youth Build, which help connect opportunity youth, teens who are disconnected from school and from work, into a program that can get them a living wage job. What I believe is the first in the country hospital-based violence intervention program collaborative between all of our hospitals coming together to share data. I'm running out of time, so I'm just going to highlight a couple more things. Opioid-only deaths in Philadelphia are declining. We have our overdose deaths overall are not because we have stimulant-involved overdoses, and we are working hard to figure out strategies that work. That is, I think, a different phenomenon, and we need to address it differently. Our tobacco policies are bearing fruit. Smoking rates are down from 25% to 15%, and they're under 2% for teens. And it's now required, if you're going to get an apartment rental license in Philadelphia, that you have a lead-free or lead-safe certification, and 95% of rentals are now certified. So I'm going to stop there. Lots more to do. And, you know, I'm just so excited to be part of this work with you and grateful for the learning we have from all of you. Thank you.